Hi, how y'all doing? Good. I had a good lunch. Do you have a good lunch? Yeah. Okay. Were you enjoying the speakers? Yeah. All right. We don't need a nap or anything. We're doing okay. Okay. Well, because I mean, I ate a cookie, so I could use a nap after cookie time. We've got until 2 o'clock, and we've got Dr. Greenfield coming at 2 o'clock. Is he in now? Oh, he's on ready now? He's ahead of schedule. How about that? It's almost like I knew. You'd think I knew. Okay, I didn't. That's okay. We're going to roll with it. Okay, so I have my integrative oncologist, Dr. Russell H. Greenfield. He serves as the Senior Director of Employee Whole Health for Whole Health Institute. Most recently, he was the Medical Director of Integrative Medicine for Novant Health with headquarters here in Charlotte and Winston-Salem. He completed his residency training, emergency medicine, Harvard UCLA Medical Center, as well as a chief resident fellowship at the same institution. After he moved to Charlotte, he became involved in emergency medical residency program at Carolina's Medical Center, and subsequently was honored as the inaugural recipient of the Golden Apple Award for Excellence in Teaching. I am honored today to have with us to speak to you about integrative oncology. And Dr. Russ Greenfield, welcome. Thank you for joining us today.
Thank you, Terry. It's quite an honor. It really is. So hi, everybody. And let me first say, I know it's right after lunch. And so if you get sleepy and need to take a nap or something like that, you do what you need to do. It's really fine. So let me share with you a little bit about why I had the great good fortune to speak with you. I am a conventionally trained physician and also trained at the University of Arizona in a 2-year fellowship in what we call integrative medicine. My peers and I define integrative medicine as healing-oriented care that takes account of the whole person. So certainly it's body, it's also mind and spirit, family, community, and environment. It's all those things in a gentle balance. And the reason is because when one area falls a little bit out of balance, it always pulls on everything else. If we can help those other areas to stay in balance, it can often help that initial area to come back into balance together with the good conventional care that people are receiving. So let's speak first of all about the reality of how difficult this journey can be, and especially at the outset. In my experience in speaking with patients, those first couple of weeks after receiving a challenging diagnosis are even more challenging, and in part because we are overwhelmed with the amount of information coming our way. And so we receive very good information from our medical team as to how we might move forward with our treatment and what can be expected. But at the same time, we're receiving lots of information from friends and family who love us, who are giving us books or magazines. We go to the internet and we find all manner of information. And then we start seeing things that are offered by the herbalist or the local health food store. And so rather than getting our information from the 17-year-old who's behind the cash register at the health food store, we start looking a little farther. And the problem is, in part, is that we as conventionally trained physicians often don't have the information about some of the complementary or even alternative therapies out there because we haven't been trained in them. By the same token, the health food store clerk or some of the people on the internet don't have conventional medical training. So as patients, we are stuck in the middle of what looks like an either or, either conventional medicine or these complementary alternative therapies. In integrative medicine, we try to take that either or and make it and. How do you use the best of conventional medical care together with complementary measures, diet, lifestyle, things of that nature that can safely be combined with your conventional care and give you a sense of control in a setting that often looks like we have no control, but we do. So the ask that goes along with this is, even if you are working with a very strongly conventional oncologist, always share with your team what you are looking to do for yourself on your own, whether that be diet, vitamins and supplements, acupuncture, because the main thing we want to do is make certain that you stay safe, because not everything that is available to you, especially during treatment, can be safely combined with the good treatment that you're receiving from your conventional practitioner. So there's a range of activities that we can participate in. But the very first thing that I would ask you to do, and it is a simple ask and a little bit of an offer as well, is to acknowledge that this is a challenging time and it is stressful. Under ordinary circumstances, we as human beings are faced with uncertainty, and it becomes all the more so with a challenging diagnosis like cancer, and all the more so in the setting of COVID. So uncertainty is almost everywhere. So where can we find some degree of certainty in that space? It's by taking control of health-related matters where we can. We can't do everything, but we can do some things. We might focus on diet, we might focus on stress management, we might focus on select complementary therapies. When folks come to see me, I usually explain to them that there may be anywhere from 3 to 25 different things that any one of us might benefit from. But if I were to offer any one of my patients 12 or 15 different things to do, 2 things are very likely to happen. 1, I'm going to increase their stress levels rather than help manage them. And 2, within a week, if they start trying to do all 10 to 12, 15 things at once, they're going to be burnt out and they're just going to throw the whole program away. So usually what we try to do is together, jointly with our patients, sit down and see what is most important to them at this moment. And then let's try and address that. And we might discuss 4, 5, 6, maybe even 7 different things that they might consider doing at this time. But we ask them to embark on no more than 1 or 2 of those things. Because not only do we want this to be effective, we also want it to be relatively easy. We don't want to add more stress. We don't want to make things more difficult. We don't want to add a lot more appointments to an already busy schedule. We want to try and make things a little bit better, a little bit more balanced. And again, include your conventional oncology team in the discussions, because most importantly, we want to make certain that you stay safe. And we'll talk in just a moment about where that becomes more of an issue with regards to some of the questions that come up about what we can do for ourselves. So there are many things that we might do for ourselves. And again, there's lots of resources, some of which are very trustworthy and some of which are a little questionable. And that's why I say you want to work with somebody who will be open and honest about having conversations with you about what is a good idea to do, what looks promising, and what really isn't a good idea or might even be dangerous, if not at least worthless. So we talk about things like diet. We talk about vitamins and supplements and herbs. We talk about movement. We talk about stress management, getting adequate sleep. And then we talk about some complementary modalities like acupuncture, massage, mindfulness, even energy medicine. So in the mix of all these things, what I hope to do with you today is just give you a broad overview about some of the things you might explore with your healthcare team and ways that you can become an active participant in your care. So from a dietary perspective, you will see all manner of things listed on the internet and or magazines or books or things of that nature. You know, should you go keto? Should you start fasting? Should you, change your diet drastically? Do you have to become vegan? All those types of things. From an integrated perspective, what we typically try to do is ask people to explore an anti-inflammatory pattern of eating. And what I mean by that is not specifically focusing on target foods, but really a pattern of eating that actually you might enjoy not only during treatment, but beyond. Understanding that there may be taste changes and you may not be able to enjoy all the foods that you usually do, but the overall idea is that if we can eat in a way that actually helps reduce untoward inflammation in the body, that may help your treatment to do its good work and also help your own body's innate healing capacity come to the fore and work even better. So what does an anti-inflammatory pattern of eating look like? It's really a Mediterranean style diet, perhaps with some Asian components in there. So we talk about things like, eating more fish than red meat, maybe using healthy fats like extra virgin olive oil, trying to enjoy healthy carbs like vegetables and certain fruits and whole grains. And so it's trying to stay away from some of the highly processed foods that are out there. But we also let folks know we're not asking you to adhere to a very strict and stringent diet. We want you to understand that we still believe that food is a source of joy. And there's way too much information out on the internet that really is more fear-mongering around food than it is about helping us to enjoy and stay healthy. So what I mean by that is if tonight is the night for pizza and ice cream, have a blast. and then say, you know, that might not have been the healthiest meal in the world, but boy, we fed our spirits. And that's just as important. Now, I don't recommend doing that every day because that's not a splurge. That's just kind of unhealthy eating on a regular basis. But the occasional splurge is not only something we think is okay, we recommend it because both during treatment and beyond, we want you fully engaged in life, in the things that are life engaging and life enhancing. And food can be one of those things. So we don't want food to be a source of fear. So if you enjoy a meal that you know isn't necessarily all that healthy for you, but feed you in another way every once in a while, not only is that okay, we recommend it. Overall, we'd like you to focus on a more healthy type of diet. So yes, do we recommend things like, if you can enjoy them, tolerate them, cruciferous vegetables like broccoli, cauliflower, kale, Brussels sprouts, watercress, things like that. Why? Yes, because they all contain naturally anti-cancer actions. And they have components that actually have been shown to help fight cancer. And they can be made to be very delicious. You'll read about all manner of foods out there. You know, can I eat this? Can I not eat that? Do I have to fast? Those types of things. And so fasting has become something that's very, very interesting because there are some preliminary, and I want to underscore that, preliminary research data suggesting that a carefully curated and personalized program of modified fasting may be beneficial for people around the time that they're receiving their chemotherapy. Now, this doesn't mean not taking in anything. It doesn't mean water fasting. It doesn't mean any of the extremes. It might mean, you know, perhaps what's called time-restricted eating, where you might eat only for, let's say, 13 hours of the day, and you might fast 11 hours, or vice versa. Some people do where they eat, just up until dinner time, and then afterwards they don't eat again until the morning. And why? Well, there's some preliminary research data suggesting that if after dinner we're not eating those, potato chips and snacks and things like that, and we stay well hydrated, the digestive tract gets to rest, which actually helps us to sleep a little bit better. And that sleep is critically important to responding to our treatment. There's also some suggestion that when we give our digestive tract a little bit more of a rest, it might reduce inflammation. It might also engage give us enough energy that our immune systems are a little bit more active. This is not something to do on your own, however, because there are some risks. If you are losing weight in an unhealthy manner, you don't want to be fasting. If you have lost a lot of muscle mass, you don't want to be fasting. If you are not taking in healthy food during the time that you're eating, you don't want to be fasting. So all of this to say, there's a lot of information out there about fasting. It is intriguing, but the research is preliminary, and you want to work with your nutritionist in order to decide whether this is something good for you or not, because again, we don't want to put you at risk. Other questions that come up are like paleo diet. Can I eat, certain other foods, etc. I don't myself recommend that people adhere to relatively strict regimens. I recommend that people eat what they can tolerate, what they can enjoy. That is also generally good for them. So that means more vegetables and fruit, healthy fats, as we spoke about, maybe more fish than red meat, those types of things. And just trying to stay away from all the highly processed foods out there because they often increase inflammation. Again, the fasting I mentioned because it's just gotten big on the radar of a lot of folks. I just simply ask you to be cautious about it. It looks interesting. It is not proven. And we just want you to be very careful about it. Now, whenever talking about diet, we also talk about movement because diet and exercise are tied together. Any degree of movement that you can do, even a little bit, looks to be beneficial. So it could be as simple as just trying to get a little bit more walking in each day. If you're doing a little bit better, you can increase the number of steps that you take. As you're getting even a little bit stronger, you might actually throw in a few intervals. What I mean by that is you'll walk gently for 2-3 minutes and then just walk a little faster for 15 or 30 seconds, back down to walking real gently for a few minutes, then back again for like 15 or 30 seconds, just kicking it up a notch, just a little bit, enough to maybe get a little bit of a sweat going if you're able to do so. You might choose to participate in some gentle yoga because stretching, flexibility can be a very nice adjunct to your care. And yoga, not being a religious practice the way it is typically taught here in the US, it's a way to also get centered because it helps bring mind and body together in a way that can be used together with any spiritual practice. It doesn't have to be a spiritual practice unto itself at all, but it's a very nice way to just center oneself, both physically and emotionally, because it's just gentle stretches and flexibility of body and mind are both very, very important in this regard. So any kind of movement you can get in, if you're feeling a little bit better and can even do a little bit of light weights, all those kinds of things are really great for you. But what we typically recommend for folks is just get out and start walking. If the weather is bad or it's getting cold, you can always turn on the TV and walk around your living room if need be. You can walk the mall while wearing your mask and trying to stay safe. Again, we want to make certain that if you are at a stage where you really want to limit your outdoor activity, it's better to do this at home so that you're not exposed to folks who may be carrying COVID unknowns to them. So any way that you can increase your movement is going to be really, really good for you. And it's also the single best stress management technique, antidepressant, anti-anxiety activity that we know of, even better than prescription medications. So movement really works and can also help with sleep. So then we talk about things like vitamins, supplements, and herbs. So you will read all manner of things about anti-cancer activities of different agents, and there's really quite a bit of promise in this regard. And I just ask you again to work with your doctors and your pharmacists to make certain that what you're taking is safe for you where you are in your treatment or beyond. Because remember, what is natural is not synonymous with what is safe. So as an example, I tell you just a story from my training days. I was taking care of a gentleman in his 50s who had a very strong family history for cardiovascular disease, for heart disease and stroke. So he decided at that time, this was back in the 1990s, he decided back at that time that he was going to take an aspirin every day to try and prevent heart disease, which is debatable, and we can talk about that another day. He was taking vitamin E to try and prevent heart disease, which actually doesn't work. He was eating a clove of garlic every day because he heard that that might help lower his cholesterol, which it might. And he was taking ginkgo biloba every day to try and remember to do all the rest of the stuff that he had to do. Now, all of that sounds fine, except every one of those things is what we call a platelet activating factor inhibiting agent. In plain English, what that means, it can increase bleeding. Now, if we don't have a good relationship with our medical team and we don't share what we're taking, we might be placing ourselves at risk because the medical team might be able to tell us, ooh, you know, you might be going in for a biopsy or surgery or something of that nature. You don't want to be using something that might increase the propensity for bleeding. So even if you feel like the doctor may not like what you're bringing up to them with regards to what it is that you might want to use, that open communication is critically important to making certain that not only that you do whatever you can to help yourself stay well and respond well to treatment, but also to stay safe. So some of the supplements that come up on a regular basis, one person already asked a question about this, is vitamin D, D as in dog. Vitamin D is actually pretty darn important for a lot of different reasons. We know that vitamin D is important for bone health, but it looks like it may also have some significant anti-cancer activity, may offer some boosting to the immune system as well, and may have some other health benefits too. The question comes up is, how much do you take? And what about just going outdoors? Well, you know, our dermatology friends are very nervous about us going outside for long periods of time and getting vitamin D from sun exposure. So usually what we recommend is, well, spend, 15 to 20 minutes out in the sun, maybe put sunscreen on your face to try and reduce wrinkles and things of that nature, but expose your arms and legs for 15 to 20 minutes, and then go back inside, put your sunscreen on, wear sun protective clothing. That can help. But even when we're heading outdoors, we're often in the shade, or we're not getting direct sun exposure to the intensity that we might need, especially during winter months. Remember that come winter, anybody who lives, let's say, north of Atlanta, the angle of the sun is such that it's really, really difficult to get enough exposure to build your vitamin D levels, which is why we recommend for most people that they take a vitamin D supplement. Now, I do want to underscore most people. If perchance the cancer has impacted your bones in any way, that can actually cause calcium levels to go up. Vitamin D helps with calcium absorption. And so if your calcium levels are increased, we actually don't necessarily recommend that you take vitamin D because that might actually bump those calcium levels into areas that are not safe for you. Again, another reason why it's important to talk with your doctors and your pharmacist about how to utilize these agents, but at the same time stay safe. Under ordinary circumstances, we generally recommend that people take anywhere from 1,000 to 2,000 what's called IUs, or international units of vitamin D. There's vitamin D2 out there, there's vitamin D3 out there. We recommend using vitamin D3 just because it's simply better utilized by the body. D2 is not harmful, just D3 looks like it's a little bit better for us. You'll hear about all manner of other supplements as well. You might hear about melatonin. You might hear about medicinal mushrooms. You might hear about something called astragalus. There's all manner of supplements out there, and many of them really look quite promising, but that doesn't mean that you specifically should be using them. So as an example, there are a number of medicinal mushrooms out there, like turkey tail. They have wonderful names. Turkey tail is also called Coriolis, and that looks like it has some significant anti-cancer activity. There is lion's mane mushroom, which looks like it may support nerve function. So these are the kinds of things that are, people are hearing about, and they hear about it from their health food store, or they hear about it from the magazine, the internet, and you want to be a little cautious about this. So as an example, the medicinal mushrooms are immune modifying agents. And why is that important? So if you are taking an immunomodulating treatment from your conventional oncologist, there is some concern that we just don't have enough research data right now to say that combining the two is actually safe for you. So if you're using, let's say, antibody therapy or any other type of immune therapy to treat the cancer, we simply don't know if adding medicinal mushrooms, which also work on the immune system, is safe for you or not. So all this goes to say, when I make recommendations to patients about vitamins, supplements, and herbs, I do my best to underscore, make sure you ask your doctor about this first. And if for no other reason, it's because if the doctor says, I know where Russ is coming from, but I don't have any research to say whether this is going to interfere with your treatment or not, they're more than likely correct. And that's simply because we don't have all the research out there for all the different combinations of treatment out there. And, if you're taking vitamins, supplements, herbs, and things of that nature. And Jessica brings up a very, very good point, which is that if you are on a clinical trial, remember that you really don't want to be taking vitamins, supplements, and herbs in general. And that's because you're on a clinical trial, and any variable that is added into the mix might really mess with the interpretation of whether you're responding well to the treatment or not. So again, that open communication is really, really important. So at the bottom line, to be honest with you, about vitamins, supplements, and herbs, and working with your oncologist or working with an integrated person like myself, what I ask my patients to do is, if I say, I think you should take this agent, I think it's a good idea, and the oncologist says, I know where Russ is coming from, but this makes me nervous because I'm not sure about it, I'd rather you didn't take it, I ask you please to listen to your oncologist. Why? Because the vitamins, supplements, and herbs are, I think, good ideas when they are recommended this way, but they are not mandatory. And so if I make the recommendation to take something and the oncologist says, don't take it, what does that do for you? It puts you in the middle. And the middle is not where we want you to be, because that's more stress. So at the bottom line, again, if I say, take vitamin D, I think it's a good idea for you, and the oncologist says, I hear what Russ is saying, but please don't take it, please listen to your oncologist. And when you're done with treatment, then we can talk about the vitamins, supplements, and herbs and things like that. Now, most of the oncologists these days are okay with some of the agents that we speak about, but not all of them. And that's completely understandable. So again, remember, if the oncologist says to you, I hear where Russ is coming from, but please don't take anything else, it's really okay. It really is. And you can start those agents when you're done with treatment. We simply are aiming to keep you safe. Now, we also get to talking about the 800-pound gorilla in the room, which is some combination of stress and fear. And that speaks to uncertainty again. And so I ask again, something that my patients have taught me, I ask that you be gentle and kind with yourselves to the degree that you can. You're going to have good days. You're going to have some days that aren't good. You're going to have some days that you need people around you, and there are some days you just want to be alone. Being alone every once in a while is okay, but isolation is not. because isolation is not good for you. So coming together in a group like this is really, really important, because group support, community is actually where healing takes place. Yes, we have within us innate healing capacity, but it is brought out when we are in communion with others, when we convene and take care of one another. One of the other things that I would ask you to consider here is, in my experience, as difficult as this journey is, it is often almost more difficult for your significant others or your spouses. And so the significant other usually wants everything to be better yesterday, and they often feel disempowered, like there's nothing they can do, without realizing that their love is an integral part of this treatment and you healing. So I say that because the significant other in your life or your spouse needs to take a break every once in a while. They may feel guilty for doing so, but it's really, really important that they do so, that they spend some time with friends, that they get out in nature, that they just do something to refill their reserves so they're not running on fumes as they're doing their best taking care of you. It also speaks to ways that you can take care of one another. So your days, your weeks can get very, very busy with various clinic appointments and other treatments and labs and things like that. I ask you to do your best to try and schedule at least one day a week where you can, where you don't have many appointments, if any at all. I'm not asking that you stop in the midst of the week, but I do ask that you create time to pause. In that pause, you get the opportunity to just create space to heal a little bit more, because when you're running, you're using up vital energy that you could use to take good care of yourselves. Now, there are also an array of complementary modalities that may be beneficial for you. Almost every patient that we meet with can benefit from acupuncture. Acupuncture is a part of Asian medical theory, has been used for thousands and thousands of years. And we understand that there are times where your conventional medical team may offer some caution. If your blood tests have come back suggesting that your white blood cell count may be very, very low, so they worry a little bit more about infection, or that your platelet counts are very low, and so they may worry a little bit more about bleeding. I understand the concern, but to be honest with you, most people do just fine with acupuncture as long as very clean modalities are used and we have people with experience helping our patients. This has been used in Asia together with conventional medical treatment for many, many decades, so that it is something that can help with pain. It often helps with nausea. It may help with sleep. And it's also very, very relaxing. I know for many of you, the last thing you want to think about is one more needle. But actually, most folks, when they get acupuncture, they usually fall asleep. It's a very relaxing therapy for most people, and it can be very beneficial. A question came up about, what are the odds that Medicare may actually reimburse for acupuncture? We are very hopeful about this. And why? Because last year, Medicare came forth and said, we believe that acupuncture should be covered under Medicare for the treatment of low back pain. So that opens the door. But the challenge is that it's only for lower back pain in certain populations right now. We think that there will be more coverage coming down the pathway, but it's just not available widely just yet. And this is one of the things that drives us crazy, because if you have a treatment that might actually benefit people, but they can't access it because they're under financial stress as well as physical stress, it makes things that much worse. So one of the ways that you might be able to access acupuncture in your community is look for the opportunity to participate in safe group acupuncture, or what's called community acupuncture. In this opportunity, hopefully where everybody is, again, this is just my bias, but I think everybody should be following COVID precautions to the nth degree to make certain that everybody stays safe. But if that is happening, under non-COVID conditions, what used to happen is 6 to 10 people could be in one room and they would not have to get disrobed. Just the front of their bodies would be treated because they'd be laying back on a little chaise lounge of sorts. The room is usually a little cool, so they're covered with a blanket as well. There's music playing. They get to meet other people, so there's that community aspect. And there's data suggesting that community or group acupuncture works just as well as one-on-one acupuncture. And it's a whole lot less expensive. Usually costs about 1/3 of the typical price. And it's usually offered in a lot of different areas. Just make certain that they are following COVID precautions. Now, with the COVID era, usually that number of 6 to 10 goes down to perhaps 3 to 5, so that people can still stay distanced and wearing masks, et cetera. But that is another way that you can access the benefit. And then some centers can train you for yourselves or your loved ones to apply acupressure. Without the use of needles or things of that nature, you can still get some of the same benefits. That speaks to human touch. And massage therapy might feel like an indulgence, go get a massage if you get the chance to go on vacation. But human touch heals. And massage, when applied in the space of cancer treatment, can be wonderfully beneficial because it is another way to pause. It's a way to just have the door closed, and the treatment is really just about you in a very different way. And where expert attention, you want to work with somebody who has experience in oncology massage, it's very different, because you don't want to just, as wonderful as some of the massage groups are out there, if they're not trained in oncology massage, I don't recommend utilizing it, because if they don't know what they're doing, they may be applying pressure over your port or over an area of involvement by the cancer. And so you want to work with somebody who really knows what they are doing and knows how much pressure to apply and how much pressure to avoid. From a stress management perspective, massage therapy can be very, very beneficial, but so can things like just breathing exercises, meditation, some of the apps that are available out there, like Headspace and Calm and Insight Timer. There's some really, really good ones out there. We just ask you to acknowledge that you are human. This is a stressful time. And the things that usually work for you, engage in them even more, as long as they are safe. And then explore some other means of managing stress too. But in this, these days where the weather outside is very, very nice, getting outdoors is one of the best ways that you can take care of that stress. And then there are other modalities like energy healing. When I first learned about this, I thought we're getting just a little bit woo-woo out here. But actually, there's some really, really intriguing data around using energy healing. And so these are things like question that's just coming up, Reiki or healing touch or therapeutic touch. And generally speaking, the folks who perform this and offer it, these are really kind, compassionate people who have taken upwards of 2 to 5 years to be trained in this modality. And the way the modality works is essentially, they say healing energy wherever you come from, whether it comes from above, from trees, from other people, from the earth, from the sky, wherever, may you come to me that I might simply direct you as a passive conduit to someone in need. And may you go wherever you need to go in order to offer the person the most benefit. And so they don't necessarily make a diagnosis. They don't say, I can heal you. They just say there's goodness in the universe. May it come to me that I might simply direct it to you, and may it do the most good it can. Now that all sounds wonderful, and it drives us scientists really crazy because we can't explain it. But we have outcomes research showing that people sleep better, that their pain is better, that they feel more connected to humanity, and that they feel more rested and content. Now, if that came in a pill, we'd all be taking it. So we recommend, again, being gentle with yourself, not diving into everything all at once, but explore the types of things that you might need at this moment. Really sitting down and thinking, what do I myself need right now, and how might I start? Not doing all the different things that we're speaking about here, but saying, if I were going to choose 1 or 2 ways, maybe I might, see if I can get into a safe group acupuncture appointment. Maybe we'll change our diet a little bit and talk to the nutritionist. Maybe I'll talk to my doctor about some of these vitamin supplements and herbs, or run them by the pharmacist to make certain that I'm safe. Maybe I'll ask my doctor about which are the websites that actually can be trusted with regards to these kinds of things. There's a lot of different ways to go here. Be gentle with yourself, because that's one of the best ways to heal, is to offer your body some chance to rest so that it's strong enough, that immune system is strong enough to respond as well as possible to treatment during and beyond the completion of treatment. So I'm going to stop here because we really have covered quite a bit of territory in a very short amount of time. There may be questions. If not, I ask you to be very careful because I can keep talking for a while. But if you do have questions, I would love to answer them to the best of my ability.
Okay, awesome. Yes, we do have some questions and we both could keep talking for quite some time, if you must know. So we could go at it till sometime tomorrow, but I'm not going to make you do that. So let me just kind of just grab the questions right off the top. And this is probably a really good place to start. How do you suggest bringing up an integrative oncologist with a doctor who's a lot more conventional in his thought process?
So that can be a challenging prospect, and it comes up a lot. And so I offer a few things to you. The first is that, and while it may not seem like this is the case, it is. It's very important to remember that you are in charge. It may not feel that way, and you feel like you've been assigned to an oncologist, and that is that's who you're going to get to work with, and that's it. No, it's really important that you work with an oncology team that meets you on your values and aligns with them. So let's say you're working with somebody who just doesn't want to talk about diet or doesn't want to, speak, and it just says, don't do any of that kind of stuff, just listen to me. They are now fewer and fewer in number, but they do exist. Don't stop seeing the oncologist, but do start looking around and see if there's somebody else that you might work with. Remember that you're not a bad patient for doing so, and you're not going to tick off your oncologist, and the oncologist is not going to stop taking care of you. You do that. Remember that all the doctors, regardless of how they approach patients, they really do want the best for you. And if it's not a good fit for you, it's okay. So I honestly, I don't want you to walk into an oncologist's office and be fearful about, can I actually bring this up or not? Remember, you actually are in charge. You get to choose who you work with and who you don't. Now, we want you to be careful about that, of course, because just because a doctor says, I'm just not comfortable with that, doesn't mean that they might not say in the next breath, well, if you bring me the information about it, we can decide together. Honestly, that's integrative medicine. So look for somebody that you have a healing relationship with. And if it doesn't work out, it's really okay to look for somebody else.
Okay. Okay, well, that's a really good place to start with advice. Is partially just being able to own who you are and take back your own wellness. And so if that's singing or dancing or painting and being able to pick your team members is kind of what you're getting, right?
It's true. And one of the questions that's coming up is, how do you find folks who will speak with you in this regard? And so again, I'm biased in this regard. My training came through the University of Arizona. And so I trust that training, and I trust the people who have gone through that training. So if you go to the Weill Center for Integrative Medicine website, and Weill is spelled W-E-I-L. There are now, I think it's close to 1,800 people around the globe who have been trained in this manner. And the training really is evidence-based, but also evidence-informed. And what I mean by that is it's not all about the randomized controlled trial. It is also about, what's the experience that people have had. One of the things that I think is really, really important is that our peers will often speak about statistics and all, and that's just because they're trying to help us understand where we are. But statistics, they describe a given population of people. So they're descriptive, but they are not predictive. And what I mean by that is the statistics can say, here's what this group of people has experienced, but it doesn't necessarily mean that's going to be what happens to you. So never let anyone take you to a place where you don't have hope for what the future might bring, because we're not soothsayers as physicians. We base our recommendations on experience and evidence, but there's other forms of evidence, including the folks who have been in very difficult circumstances and yet found a way to do well. Now, does it happen every single day? It doesn't, and that makes us very sad. Does it happen for everybody? No, but the mere fact that it happens means that every one of us can have some degree of hope that maybe things can be better. And so working with folks that help engender that sense of hope where it's appropriate. We're not talking about undue optimism. We're saying that miraculous things every once in a while might happen. And so what can we do to give us the best chance of that happening? It's taking control where we can. It's optimizing our overall health and well-being together with the best of conventional medical care. And then we sit back and see what might happen. go to the Wild Center for Integrative Medicine website, and there you can look up where are practitioners who are close to you, who may have expertise in this realm. And if you don't see a list, you can always contact that practitioner and see if they know somebody that you might be able to reach out to.
That's a good point. Is that on an international basis, that Weil Institute?
Actually, it is, because there are practitioners who have been trained all over the globe. The initial program, when I was in the very first class, and so the first few years were actually, we were in person. So we spent 2 years out at the University of Arizona. But from those initial years, they created an online program for practitioners, and that allows nurses, physicians from all over the world to interact, to learn, but also to share their own experiences of what they have witnessed to help and benefit patients. And so it's a very, very rich community, and it's something that I highly recommend. Generally speaking, here in the US, if you meet with an integrative medicine doctor, it's usually covered. Now, you want to contact your insurance company first just to make sure, but usually it is covered by insurance. The acupuncturist, the massage therapist, things like that often are not. But another thing that you can do that typically is covered by insurance is to ask for what's called an MTM session with your pharmacist. And that's medication therapy management session. It is typically covered by insurance. It is usually covered by Medicare. And what that means is the pharmacist sits down with you and goes over your list of prescription medications, as well as your vitamins, supplements, and herbs, to make certain that the medications and the herbs are playing well with each other in the sandbox and not causing untoward interactions.
Okay, that's crucial information. And that was MTM, right? Okay.
Medication therapy management session. Again, call first to make sure that it's covered, but that can be very beneficial.
Right, because that would be the first place to start, it sounds like, is get that, or come see somebody like you, which is a better place. That the first place I would start is come see an integrative oncologist, go see a nutritionist. Would I come see you first? Where does that fall in my next steps?
Terry, it's a really great question. And it's not set in stone, because for a lot of folks, as soon as the diagnosis occurs, all of a sudden they're presented with, you're going to go to the lab, you're going to the radiation person, you're going to meet with the oncologist, you may have to meet with the surgeon. You have all these different schedules. And so one more appointment may be one too many. It all depends on where the person is. And so we usually say we will meet with people wherever they are on the journey. And so it might be right after a diagnosis, in which case we say, hey, there's a lot going on right now. Let's wait until you gather a little bit more information about what the treatment might entail, what the doctor's going to recommend, and then come on back and we'll talk about, how might you get started. But at any point, doing what you can to manage stress, to have access to credible resources that you can share with your physicians, so that everybody is working together on one team. And so that, and in our institution, one of the nice things is that we were included in the medical record. So this way, the oncology team could always see what we're recommending. If they had questions, they could reach out to us. We were all working together in that regard. And that's why I say, again, when you're working with an integrative doctor, they're not going to say, hey, don't do chemotherapy or things like that. They're going to say, well, let's bring everybody all together and talk about this, what's in your best interest. And usually, again, I'm not an oncologist by training, but I work with really good ones. So I trust them. And generally speaking, they trust what I'm going to recommend, because they know that I have safety and the person's successful outcome at heart. So usually it means meeting with the conventional medical team first to have an understanding of what the treatment recommendations are going to be, and then sitting down with the integrative team to see how can we all work together.
Okay, so that sounds good. So it's almost like we need to have an integrative oncologist like you on our tumor boards to kind of help us figure out what's next is, and maybe not if first diagnosis, but as we're kind of moving forward, that's kind of how it's sounding, right?
Well, Terry, again, at most major cancer centers now, to be considered a comprehensive cancer center, you have to offer integrative oncology in some way, shape, or form. And we're always present at most of the tumor boards, because we want to be able to share our information. Also, many of our patients are presented to the tumor board, so we want to be fully informed. So, we're actually an included part of the overall care. I saw another question that came up, Terry, just real quick, about IV vitamin C. And this is something that comes up a lot. You'll read about some of these different modalities, some of which are frankly alternative in nature and may not be a good idea, vitamin C is actually a really interesting one, but it is not without its own controversy. So vitamin C is an antioxidant, as you may know. What that means is that it prevents oxidative damage in the body under ordinary circumstances. So that might come from too much sun exposure or toxic exposures in the environment. So eating foods that are high in vitamin C, like vegetables and fruits, can be very good. Sometimes taking vitamin C supplements can be very good. Vitamin C in very high doses can be what's called a pro-oxidant. And so in very high doses, it might actually induce damage. And so, generally speaking, we've been saying stay away from very high doses, especially taken by mouth, because they might cause stomach upset or diarrhea or gas or things of that nature. But there are some intriguing preliminary studies looking at very high doses of vitamin C given intravenously. Why given IV? Because if you take a lot of vitamin C by mouth, only a little bit of it gets absorbed. So if you deliver large doses of it by IV, there's some suggestion that it might actually help during and after treatment. Where it becomes questionable is that high doses of antioxidants during treatment, especially with chemotherapy, may actually counteract the benefits of chemotherapy. So this is again why I say, if you're looking to go down this path, you really want to include your oncology team in the decision-making process. You might be able to do something like vitamin C, even IV vitamin C, with immunotherapy or something of that nature. But with standard chemotherapy, antioxidants in high doses might actually interfere with the treatment and really might interfere with treatment if you're receiving radiation therapy. So again, you want to sit down with somebody and say, how can I make sense of all the information out there, some of it being misinformation, and do what's really safe for me?
Okay, now we have a lot of folks that go through like immunotherapy and radiation and stuff. Do you have anything that you could kind of like speak to in general terms about those particular treatments?
So, with immunotherapy, one of the wonderful things in the oncology space is I've been working in integrative medicine now for nearly 25 years. And for years and years and years, my oncology peers would say, we're going to get to the state where if we can just make cancer be like a chronic malady, like high blood pressure or diabetes, because the next day the answer might come, or the next day or the next day. Well, over the past 8 to 10 years, some of those answers really have come, largely in the form of targeted therapies and immunotherapies. And so it's amazing, as many of you may have experienced, the sheer range of options that are now available that really seem to help people. Some of which have just come about in this past year, was specifically around KRAS and all. And so every day new things are coming out. And then it becomes challenging because it's new. What does it mean if we're taking a vitamin or supplement or things like that? And remember that vitamins and supplements are just one part of overall integrative medicine. So if there's uncertainty about safety, we usually ask people not to use it, especially if it's a new agent that we're just exploring, or as stated before, if you're on a clinical trial. But the things that you can use are things like acupuncture and massage, any type of stress management technique. Diet, remember, is not something just to be used to help prevent disease. It can also be used to help treat disease, including cancer. So there are lots of different ways to do this. There is a team out on the West Coast that created a cookbook called The Cancer Fighting Kitchen. And a woman by the name of Rebecca Katz created that. She also created an online program associated with it. The book, The Cancer Fighting Kitchen, is really, really good, but keep in mind it is a cookbook, so it has a lot of ingredients. And again, with change in taste and things like that, you may not be able to tolerate everything in there. But the website offers a lot of really nourishing beverages and soups and different kinds of foods that, again, reduce inflammation and don't have nearly as many ingredients. So taking a look at something like that. Another book that we often recommend to folks is Eating Well Through Cancer. And this book I like a lot because it speaks specifically to how to manage some of the symptoms that might pop up during treatment, whether that be constipation or change in taste or nausea or things of that nature. There are different foods that you might be able to use in order to help you get through the treatment and then heal thereafter. So a lot of the treatment, Terry, really is, or the questions that come up are really individualized. Yes, there are some things that are more general, but it really depends on the individual person's path and then focusing again on what's important to them at this moment, and how can we craft a program that's reasonable and rational and actionable and not overwhelming.
Okay, so my takeaway from what you're saying is this is about healing on my inside, feeling good, whether that means that occasionally I indulge in pizza and ice cream, or, if it makes me feel good to sing despite I have a lousy singing voice, that sort of a thing. Is that correct?
One of the things that my patients have taught me this, and Terry, you may have heard me say this, but it wasn't really verbalized by them, but it was very clear that the centerpiece of healing in any circumstance, but especially in this circumstance around cancer and healing after treatment, is kindness. However, in this regard, it's kindness towards ourselves. Now, oftentimes that is not an easy thing because we equate it with selfishness, and that's not what I am talking about. None of you in this audience are going to be selfish. I will ask you, however, to act in a way that may be more self-sustaining. What I mean by that is, if you give yourself a break to go take a walk or listen to some music or just tell your family, I just need a pause to be by myself, or go out and meet with a friend or things like that, that's not selfish. That's sustaining in a way that engages your innate energies and is helping to build them up again. So there's a big difference between being selfish and self-sustaining. I do recommend that you act in ways that are self-sustaining and that your significant others do as well. Terry, I saw another question came up about repurposed drugs, and it is an area that of great interest because this is discussions about things like metformin and doxycycline and statins and even antiparasitic drugs, and that has become even more of an issue these days. So the intriguing thing about this is that some of these repurposed agents have been shown for a long, long time to have anti-cancer activity, especially something like metformin. But we, again, just like we talk about with vitamins, supplements, and herbs, we don't have a lot of research data about combining them with conventional therapies, especially some of the newer therapies like immunotherapies, et cetera. I think there's a great deal of promise here. But remember that even though the drugs have been studied and we know about their safety profile or lack thereof, it doesn't mean that they're not without risks. So, for example, metformin, which is an agent that's typically used for people with type 2 diabetes or polycystic ovarian syndrome, this agent rarely can cause a very severe form of what's called acidosis. And so we ask people to just be very, very cautious about doing this. And again, making certain that you're working with your doctor in this regard. Now, I myself am not opposed to people exploring this path as long as it's done in concert with their conventional oncologist, because if something's going wrong, we need to make certain that we understand everything that a person is doing. If something's going right, we want to celebrate that and maybe share it with others as well. The one area that I would ask you to be very careful about, so we talked about, the other agents that are used there, but the antiparasitic drugs that are often used in combination here are something that really have not been well studied. There's a lot of stuff on the internet about this, and people saying that, in some instances it has saved their lives and all. And I think, yes, like the dog dewormers, yes. And so, there's something called febendazole. The human form of it is called mebendazole. So there's a lot of folks who are going out to, I'm not even talking about ivermectin and COVID these days, which is not something I recommend at all. But a lot of people are going out and using these types of things. And what I have seen is I've honestly not seen a lot of people benefit from it. And I have seen people experience liver damage from it. Now, what they've typically done is they've dropped the dosage down, and then their liver enzymes seem to be better. But again, there's some stuff on the internet which makes it sound like for select individuals, this agent might be beneficial. But even they are not saying everybody needs to take this. And again, taking veterinary medicines by human beings, not something that I'm generally getting behind. So I think, looking at things like metformin, looking at things like doxycycline, which is an antibiotic, looking at things like statins, I think that's something that you can bring up to your oncologist. Most of the oncologists are not going to be really crazy about using the antiparasitic drugs. Again, it's a very personal decision, but generally speaking, it's not something that I recommend.
So it sounds very high risk and kind of like playing Russian roulette with your body. That's kind of what I'm getting out of that. Okay, and then, this is like a really good way to kind of just like wrap up our session here. It's like, we have so many friends and family members that really just care about us, and they all have an opinion as to what we should or should not do.
Right.
It's eat this or don't do that. How can we deal with them and still be kind to us and be kind to them? Give us some guidance.
So it's a question that comes up a lot, and our loved ones often, they don't mean to, but our friends and our loved ones sometimes bring us down. They don't mean to, and that's just them dealing with their own stuff, their own fears, things of that nature. And so what I typically recommend to folks is that if you have, what I recommend is when people call and they're behaving in that way without them, they don't mean to, but they just do. What we typically recommend is let them know that, I usually say, let them know Dr. Greenfield said I need to limit my time on the phone. And I thank you so much for calling, and I will reach back out to you when it is appropriate, excuse me. And I so thank you for reaching out. And you blame it on me, or you blame it on your oncologist, so that way you're not saying no, but you're letting them know, I'll call you when I have more time, but it's been recommended that I limit my time on the phone. The folks who call and are bringing you up and say, let's go out for tea, or let's go catch a movie or something, those are the folks you want to hang on the phone with. But the other thing that you can do is, just as Terry spoke about, earlier, Caring Bridge and, your Facebook page, if it is, that's a great way, if you choose, to keep people up to date and let people send their well-meaning messages to you that way without it taking up all your time on the phone. So again, to the extent that you can keep this in mind, and it's not easy, remember, you are in charge. And so you manage your time and who you want to spend time with. You're not being selfish to do so. You're being self-sustaining to do so. You are in charge with which doctor you choose to work with. If your oncologist offers a treatment for you, remember, it's an offer. It's not a mandate or an order. If I recommend something for you, it's not a mandate or an order. We do this together because that's the way healing takes place.
Totally. And so what I'm hearing is we're getting empowered by learning and understanding so we can apply it and take best care of our bodies. And it's our body. And so the doctors and our friends and whatever are all like well-meaning, and they can choose to be team members, or we can choose to like not have them on our team. And we're going to blame you. We like having a doctor that we can blame. Thank you so much for that.
It's all good.
Not done with you yet, Dr. Russ. We still have one more little activity for you to do with us if you're willing, because we've done this with all our amazing presenters today. Is that we, as a group, we've used our little motto to kind of like empower, because we are a community. So doctor prescribed community, and we're learning, so that we're learning how to become empowered and engaged. And that's part of what you're doing here. And so what we've done is we do as a group, Kick Cancer's KRAS. I like count it off, 1, 2, 3, and then we as a group do it. If you're okay with that, we'd like to engage you too. Is that all right?
Thank you. That'd be wonderful.
Okay, y'all. You guys are the pros at this now. Okay, so 1, 2, 3. Kick Cancer's KRAS. Thank you so much for joining us today, Dr. Greenfield.
It's been a great privilege. You guys all take good care of yourselves individually and collectively.
Okay, thank you. Okay.